10 years ago, the UN established the mandate of the UN Independent Expert on the Enjoyment of Human Rights by Persons with Albinism, the UN Independent Expert on Albinism for short. The mandate was set up in terms of Resolution 286 of the Human Rights Council, in response to a global increase in reports of severe human rights abuses against persons with albinism. Since then, there have been two mandate holders. Ms. Ikeponswa-Iro was the first UN independent expert, taking up the position in 2015 and staying on for the mandated 6 years till June 2021. In July 2021, Muluka Ann Miti-Drummond was appointed as second independent expert on albinism, continuing the work of Ms. Iro. But what has having a UN independent expert actually achieved? There has been increased awareness and understanding of albinism and the varied forms of human rights violations persons with albinism experience. Over the past 10 years, 19 thematic reports have been produced under the mandate on the situation of persons with albinism and the human rights concerns that affect them. The mandate of the independent expert has helped in developing an understanding of the root causes of discrimination and harmful practices against persons with albinism. It has helped in advancing human rights standards applicable to persons with albinism, framing attacks as forms of torture and trafficking, showing how persons with albinism fall within the understanding of disability contained in the Convention on the Rights of Persons with Disabilities, and ensuring a recognition of the multiple and intersectional discrimination experienced by persons with albinism, including on the basis of disability, color, and in some cases, age and gender. It has shown how attacks can constitute hate crimes and has contributed to advancing the economic, social, and cultural rights of persons with albinism, particularly in the areas of education, health, and employment. It has shown that persons with albinism are not merely recipients of human rights defense work, but human rights defenders in their own right. In addition, it has uncovered the implications of emerging global challenges on persons with albinism, particularly in the area of migration, climate change, and the right to family life. Together, the experts have carried out 11 country visits to Brazil, Panama, and the US, including Puerto Rico in the Americas, Fiji in Asia Pacific, and a number of African countries. The experts have issued official communications to authorities related to attacks, mutilations, killings, and trafficking, threats and intimidation directed at human rights defenders advocating for persons with albinism and with albinism, as well as healthcare for persons with albinism, particularly in relation to skin cancer. It is worth noting that there have been hundreds of reported cases of attacks and other human rights violations against persons with albinism, but only 26 communications, due to a lack of reporting or insufficient reporting to the mandate holders in a manner that they could respond to. No doubt the inaccessible procedure of reporting, the low level of literacy among those affected, and the secrecy and fear that surrounds attacks has contributed to this. Advances at the international level have included more treaty bodies highlighting the obligations of states to protect the rights of persons with albinism. The UN Secretary General issuing biannual reports highlighting the social development challenges faced by persons with albinism. More special procedures have addressed issues related to albinism through various statements, communications, reports, and public engagements. In addition, UN agencies have developed reports, implemented programs, and contributed to advancing rights of persons with albinism in the area of child rights, trafficking, and migration. At the regional level, we have seen the adoption of the Protocol on the Rights of Persons with Disability in Africa, which specifically mentions persons with albinism, the Regional Action Plan on Albinism, and the AU Plan of Action to End Attacks Against Persons with Albinism, as well as a decision by the AU to establish a mandate for a special envoy for persons with albinism. The Pan-African Parliament has adopted guidelines on the elimination of harmful practices related to accusations of witchcraft and ritual attacks which affect persons with albinism. The African Committee of Experts has carried out fact-finding missions in Malawi and the United Republic of Tanzania on children with albinism, as well as hold a day of general discussion on the solutions to the challenges faced by children with albinism. Last year, the Southern Africa Development Community adopted the Declaration on the Protection of Persons with Albinism, which has a number of promising provisions for their rights. In addition, resolutions have been adopted by the African Commission, Pan-African Parliament, African Committee, as well as the European Parliament. At the national level, there's been the legal recognition of albinism as a disability in Uganda and Ghana, the adoption of albinism-specific legislation in Guinea, Panama, Puerto Rico, and the province of San Juan in Brazil. National action plans on albinism have been adopted in Angola, Malawi, Mozambique, Uganda, and the United Republic of Tanzania. A number of countries have included questions on albinism in their national census, thus ensuring data on albinism is available in their countries. Inclusion of albinism in climate change adaptation policies has also occurred in other countries. In addition, healthcare goods and services essential for persons with albinism are provided in several countries around the globe, and measures addressing attacks, violence, and trafficking of persons with albinism have also been taken in different countries, including prosecutions of perpetrators. There has been recognition that attacks against persons with albinism may constitute a ground for asylum, as well as social protection services targeting persons with albinism adopted in various countries. The representation of persons with albinism in the media, political life, and the public sphere has increased in a positive way. In addition, some countries have ensured budget allocation for albinism groups and programs. The independent expert calls on states and other stakeholders to continue engaging on albinism issues in Africa. In addition, the expert recommends that the stakeholders increase their engagement on concerns of persons with albinism outside of Africa. The independent expert calls on states to increase their engagement with the mandate, including through extending invitations, making timely submissions to call for inputs, engaging in interactive dialogue, and responding to communications. Quite importantly, the independent expert also calls on states and other stakeholders to implement the already existing recommendations of the mandate from the other reports.